welcome to Maximize Chiropractic. I'm Victoria and I'm going to go ahead and show you how to walk through a corrective care adjustment. First, you're going to come in and you're going to sign into our office. And you're going to go overhead here and walk over to traction. Approximately want this directly at your nose level. What it's going to do is it's going to stretch and release the ligaments in your muscles and your neck through the spine. Approximately squat 30 times, feet shoulder length apart. Then you're going to go ahead and you're going to walk over the wobble disc. Going to put motion into the spine as well as replenish the blood in the discs of the spine. First, you're going to start with side to side. Do this for approximately 30 to 45 seconds. Next, going to bring chin inward. All the way down, rolling the spine downward, bringing it all the way to the sky, down to the sky. All three of these movements are going to put motion into the spine. The third motion that you will do is side to side. Building that range of motion while you're turning. After you have finished your wobble disc, you're going to go ahead and walk into the adjusting room where Dr. Tim will adjust you.
All right, Victoria, so let's go ahead and get you adjusted first. So when we're always adjusting patients, we're emphasizing the importance of analyzing the X-rays prior to the adjustments to see exactly where the adjustment needs to be applied to not only relieve the pain and symptoms, but also actually correct the subluxation that's in concern. Go ahead and tuck your chin down. Now what we're using is an arthrosin. What this is going to do is apply proper motion into the segments that are subluxated. Alright, now as you can see, it's very comfortable, no pain whatsoever. So Victoria, go ahead and come over here. Let's go ahead and lay you on your stomach. So always while we're adjusting, we're looking exactly at the X-rays to see the exact area to where she will be adjusted. Alright, so when we're adjusting the spine, we're looking for any subluxations or mini misalignments of the vertebra. And as you can tell in certain areas of Victoria's spine right here, is that these areas are out of its proper alignment. So the whole purpose of adjusting the spine for a corrective aspect is actually to realign the way that your brain sends the messages down the spinal cord and out those spinal nerves. The nerves in the spine, they go to areas like muscles and tissues, but more importantly, is they actually go to your organs as well. Alright, Victoria, power's on. So after the adjustment, what we're going to do is have Victoria actually go ahead and stand on vibration. What this is going to do is you can come follow me. So vibration's implemented to strengthen and stabilize the spine. What we do is apply certain weights and tractioning systems, and this way we can actually get the corrective aspect of the adjustment. Go ahead and place this on. Alright. So Victoria's going to stand on the vibration. This is going to help to strengthen all the adjustment that we did, so that way it will be for a lasting effect. Alright, Victoria, we're going to have you look straight up in the sky.
Now what you want to do at this point you want to find a spot up above and looking straight at that, focusing on that spot. Your body's going to go wherever your eyes go. So keeping focused on that spot is going to ensure that your body stays straight. You want to focus on proper posture as well as proper alignment through the spine. You want to make sure everything's even while you're on here. You don't want to be sitting on here like this.
Hi, at Maximize Chiropractic, we stress the importance of analyzing your spine and nervous system for two very important reasons. Number one, all health and healing is right up here in your brain. Now your brain sends messages down your spinal cord, out these little spinal nerves, and these nerves go to every single muscle, tissue, cell, and more importantly, every single organ in your body. So in order for your heart to beat, your lungs to breathe, or your body to communicate, or for your legs to function properly, your brain has to be communicating with these nerves at 100%. Now, when we look at the spine, we want to make sure that there's three proper curves from the side, as you see right here in this picture. If you lose these curves, what happens is that pressure is placed on these nerves. The nerves may go to your muscles and tissues, creating some pain, or they may have no pain perception whatsoever. But here's the thing, is that if pressure is being placed on the nerve going straight to your heart, over the course of time, your brain's not going to communicate to that structure at 100%. Everybody knows if you were to take a pair of scissors, cut the nerve going straight to your heart would stop immediately, ifs, ands, or buts. But instead of cutting that nerve, if you actually put a little pressure or irritation on that nerve, over the course of time, what's going to happen is that your brain's not going to be in proper communication with that particular organ. So the importance of this is to have an X-ray on your spine, have it corrected and analyzed by a Maximized Living doctor to ensure that your health's at 100%. What I'm going to do is actually show you on Victoria's X-ray the areas of concern and why we take X-rays in this office. Come on over. So if you notice right here, what we see is a normal X-ray. The backward 45-degree curve right here is essentially called the arc of life. When we look at Victoria's X-ray, what we see, number one, is the lost 100% of the curve in her neck. What this is causing is interference between her brain communicating with every single muscle, tissue, and cell in her body. The importance is that with the adjustments we apply here, is that we start to apply this proper curve into the neck. The reason why a curve needs to be applied is, number one, pressure and tension is taken off her spinal cord and brainstem, and secondly, structurally speaking, no degeneration or damage is going to occur in the future. It's all about preventative and wellness care here.